If your hands and feet burn while you feel like someone's pricking you, then your diabetes has reached on next level. Within just few years, diabetes can reach its complications and reduce your life expectancy by almost 10 years. The disease starts with problem in your pancreas, whose main function is to maintain sugar in your blood. By secreting two important hormones, pancreas regulates the ups and downs in blood sugar levels. But when it stops making enough insulin, or if body does not use it properly, then sugar begins to stay in your blood instead of reaching to the cells. Timely, these sugar levels are raised in blood, and insulin which lowers them become deficient, which creates a condition known as type 2 diabetes. The difference lies in type 1 diabetes, where our immune system attacks the insulin producing beta cells in pancreas that reduce or stop the production of natural insulin. The effects of diabetes appear as you begin to feel very hungry and thirsty, but lose your body weight rapidly. You feel weak and tired, and things begin to seem blurred due to vaginal defect. Dehydration makes your skin dry and the urine output is highly increased. If you ignore all these signs and continue with normal routine, then diabetes may fail your major organs like heart or kidney. Main nerves start to damage, causing numbness, pain or burning in hands and feet, ending up making you completely blind. While the primary cause is insulin resistance and belongs to body or pancreas, but some main factors that leads to diabetes are being a victim of overweight, poor diet habits, and not engaging physically through exercise or any activity. People think that they cannot eat fruits in diabetes, which is totally wrong concept. Fruits are a source of nutrients and should never be avoided with moderation. If a person is stuck with diabetes, he has to leave all the causative factors instead. Secondly, medicines just like metformin are given to lower glucose levels and improve insulin sensitivity. But if medicines do not work, then insulin itself is orally injected to diabetic patient on daily basis. Along with it, manage your weight and avoid the foods that spike your sugar levels to keep the diabetic balance.